But that's a way how I prevent that my students will cheat. Yeah, I'm Samuel Lynch, world champion arm wrestler, physiotherapist, and today we will talk about medial elbow pain. And it's so-called golfer's elbow, but actually it could be called arm wrestler's elbow or climber's elbow or any sport which have to throw, baseball or javelin or even sport which are some use rackets or sticks or bats where you have to hit. So and actually we talk about golf. It's strange, but in golf medial elbow pain are 5 times less than lateral elbow pain. So arm wrestling elbow, we have a number of muscles which are doing finger flexion, wrist flexion, hand flexion, also hand rotation or pronation, and they all have one common attachment point, so one common tendon here at medial elbow. And classical or standard medial epicondylitis or so-called golfer elbow is when you have injury, tear or degeneration or overuse, trauma here at tendon connection point at medial elbow. And very basic therapy at first, of course it depends on a period you have. For first it could be maybe rest or some anti-inflammation therapy, but after that basic theory is you have to get this tendon stronger. So you have to get more energy here to get more strength here. So you have to work on those muscles which are doing the action and strengthening the tendon which are connecting here to this medial elbow. Second thing is, like always when we talk about elbow problems, it's very rare that it's really connected with some elbow movements. Usually you always have to look one segment higher or one segment lower. So it's wrist and hand. You have to think about wrist mobility, supination, pronation, flexion, extension, and even more often it's connected with shoulder. So you have to strength and mobility in all range of shoulder. Usually or most likely internal or medial elbow problems will be connected with problems in internal rotation in shoulder. Lateral elbow will be connected with external rotation in shoulder in all range. Come on, Ray, just to show maybe how to check for external rotation, arms up. So you have to check, can you do full external rotation, keep your lower back closed, keep your rib cage down, full external rotation here. You can also check, can you put your arms together, keep your shoulders closed here. It's already a little bit shorter. Elbows down, check this range. Can you do it here? It's okay, it's almost full range. Good. You can also come here from put one arm on. Yeah. You can also try a different angle. You can put here, put in front. So again, it's external rotation. So we are checking, do you have the same range? Check for one arm, check for other arm. It's mobility, it's range movement. So what you have to look for, it's usually some restrictions in movement, also motor activity, sometimes overuse, sometimes underactivity, sometimes overactivity. Usually we have to think that all this internal rotation line is like one chain, and if you have problem in one link, in one area, it's very possibly it's connected with other. So one point is overusing or overworking for some other points. It's almost always elbows are connected with shoulders or hand and wrist. That's about shoulders, but like I said before, first thing you have to make this flexor tendon stronger. So I will show you some exercise, and basically those are arm wrestling exercise. What we are doing and what others should do to get this tendon stronger and get this attachment point stronger. Physiotherapists, docs and coaches usually recommend to do wrist curls for strengthening elbow tendon, for this flexor tendon. I myself, for my clients, for myself, and also for my arm wrestling students, have found that actually doing finger curls are much more effective to strengthen this tendon which are connecting to medial elbow. So this is exercise for hand and finger flexors. It really depends on what period you are or how much pain you have. You can start basically even with statics, hold for 10-20 seconds, and one more thing, you don't want to make it worse. So if you start, it's good if you don't have pain, or pain is very little for first few seconds and then it's gone. If it's getting more painful when you're doing, after first set, second set, or after a few repetitions, just stop it. It's not for you. You are not ready for this. So start very basic. Just hold. I would say 3 sets, 10-15 seconds. If you feel good with that, you can start with a slowly eccentric phase. You can even help to curl back, and again slowly eccentric phase. And if you feel good, no pain, everything is fine, work full range, concentric, eccentric, but don't make it more painful. Actually, you should even feel some relief or pump, and we're getting more blood, more energy here to the tendon which are connecting this attachment point to medial elbow. Pain is body's self-saving reaction. Bodies or brain or anything which are producing this pain are trying to self our structure for not damaging it totally. So like I said before, first of all, first group which are connecting and having attachment point to medial elbow are all hand and wrist and finger flexors. Other main group which are connecting to medial elbow here are pronator muscles, or muscles which are doing internal rotation. Again, to get healthy muscle, to get a strong tendon, you have to increase strength in this muscle. I will use again same handle or bar. If you want less stress, less load, take it up. Again, pain. Pain is the first thing you have to focus. Do external rotation. If you feel pain in some point, get back 10-15 degrees. You can start with statics. Again, 10-15 seconds, 3 sets. Get back to starting position. Some short rest. Again, same thing. Hold statics. If you feel fine, go forward. Same we did with fingers. You're doing slowly eccentrics. No pain. It's good if you can get some stretch here. Help with other arm. Get back to starting position. Slow eccentric regime. Feel fine. Get back to starting position. No pain, everything fine. Start work with full range or full movement amplitude, both eccentric and concentric muscle action. So here muscle length is getting longer, here muscle is shortening, and this is concentric regime. I would say 10-15 repetitions. You can go up later up to even 20-25, 3 sets. There are number of muscles and there are number of exercise, but basically there are 2 main muscle groups which are connecting to medial elbow. So it's hand and finger flexors. I'm repeating again same thing just to make sure you understand. And they are in their internal rotation, so pronation group muscles. So we did those 2 exercises, and there are a lot of other exercises, and if you want you can ask and we could show you more, but that should be enough for beginning to start at least with those 2. But we will show you one more thing, how how I work with my clients and also with my athletes to get better shoulder range of motion and get better shoulder health. Like I mentioned before, healthy, full range, motor active shoulder is one of most important keys of healthy elbows. Your problem is right elbow, and so first of all we can check just a full range of motion here, external rotation, internal, and what I see you have more problem actually with internal rotations than external. I'm not sure how sterile it is, but that's what I'm doing. I could do the same with arm, but it's easier to do with leg. So I'm pressing your shoulder joint down here, so you are not compensating with all shoulder scapula. Slowly, do it slowly, open up here, hold it here up, keep your lower back down, keep your rib cage down, yeah, and work with this shoulder movement. Normal movement, don't go forward here with your elbow. It should be 45 degrees forward internal rotation, and actually you are missing some 20-30 degrees, I would say, here. And you have quite good external rotation here on this angle. That's very good way to do it. You can do it the same without pressing the shoulder joint down, but that's a way how I prevent that my students will cheat. Where do you feel stretch?
Here.
Yeah. Perfect. Perfect. Another way, you can stay down on your back, like we did on a wall standing. Rotation back. Keep your rib cage down. Try to separate your arms here. Press your elbows down. Breathe in, breathe out, hold in this position. Do the same when your elbows are close here. Almost in every angle you should try to touch the floor. So open up your.
I feel that right is good, but left is not going down.
Yeah.
Yeah. Left is staying up.
So actually, your right arm are having some restrictions in internal rotation, and your left arm is having some restrictions here in external rotation. Yeah. And that's very often problem with arm wrestlers. If we talk about arm wrestling, rotation is one of our main moves. Very often, if you will have problems with internal rotation somewhere here in elbow joint, lately or faster or after some period, it's very often you will have some problems. And it's also opposite. If you have problems with elbows, medial elbows, lateral elbows, it's just a period of time. You can wait for your shoulder problems. It's all connected. Yeah. Never look to the pain where it is. It's not always a point. Problem is not only on the point where the pain is. It's very often or more often, much more often, one level lower, one level higher. Okay, that's one of ways how we are dealing with medial elbow pains or medial epicondylitis here in Latvia, and that's how we are working with our students and arm wrestlers. You want something to say?
If you have had any golfer's elbow symptoms or problems with medial elbow, please let us know in comment section. Have you dealt with it? What has worked for you? We would love to know. And if it still hasn't worked, why it hasn't worked, and what have you tried? So most important part, be healthy.
And also remember, sometimes work prophylactic is even more important.
Yeah.
So stay healthy, stay strong.
Yeah. And love arm wrestling.